I'm joined now by the Director of Addiction Services at Emory Healthcare, Dr. Justine Welsh, and by the Chief Medical Officer at Hazelden Betty Ford Foundation, Dr. Marvin Seppala. Thank you both so much for joining us today. I'd like to begin, if we could, with the reality that we are all living in this year with the COVID-19 pandemic. And specifically, I'd like to ask you both what change you have seen regarding patients seeking treatment during this pandemic. Dr. Welsh, I'll begin with you.
So first, let me start by thanking you for bringing attention to this incredibly important topic. As far as patient care, most recently in the context of the COVID-19 pandemic, I've seen an increase in the number of patients seeking treatment, as well as the severity of substance use, including opioids, alcohol, and stimulants like cocaine. People are presenting to care who may have been stable in their recovery, then relapsed, or are completely new to treatment. However, I would really say that the biggest change has been how we deliver care through telemedicine or virtual services. It has allowed us to see people more frequently and from farther distances across the state of Georgia than ever before. I'm hopeful that we will continue to provide these services once the pandemic subsides.
Dr. Welsh, thank you. Dr. Seppala, if you could answer that question.
Yes, I'd say the same as Justine. We've gone to virtual services in our outpatient system and had tremendous growth there. But in our residential programming, where people would come in and stay for a few weeks that have a higher need and more risk, there's been a description from our access to care team who takes all the phone calls. And they said that they haven't heard kind of the desperation that they're hearing from people right now in a regular way. On occasion, they would get people that are desperate, of course, but this has become the norm where people just have to get in. They want to get in, figure out a way to get into treatment right now because things are going so bad. And I think it's related to COVID and the excess stress that's going on in all of our lives under these circumstances.
Dr. Seppala, I've had several people reach out to me when they found out that we were doing this special on opioids and say that they live with chronic disabling pain and that opioids are important in their life and that they were concerned that we would be demonizing opioids. Can you speak to that issue?
Yeah, I'd be glad to. Opioids are remarkable medications when used appropriately, and they're the only medications that actually work for certain types of pain and certain severity of pain. I mean, moderate to severe pain in most cases requires opioids. They're fantastic for acute pain, like post-surgical pain. It lasts a few weeks, it's gone. It's severe. Opioids are great. And for chronic pain, though, we're coming to an understanding from the research that they don't work well over time. And that's how we got into this problem, that there's a loosening of the guidelines associated with use of opioids throughout medicine, allowing prescribing for chronic pain and actually promoting it, resulting in the crisis that we're in now. So people that have legitimate chronic pain need to have really good pain docs and pain teams to help them out to figure out alternative ways to address that pain than opioids. Now, that's not everyone. It is most people. Most people can get by without opioids that have chronic pain. There are certain people that require opioids, and they need to have those medications, and they need really good teams, really good physicians that know that type of pain and know those medications, because the risk is so high.
So if you're legally prescribed opioids for short or long-term use, are there things that you can do to avoid becoming addicted or warning signs that you know to even look for?
Yeah, the first thing is, are you using them as prescribed? That's a big feature. People start escalating their dosage, taking more than prescribed or taking it more frequently. That's a bad sign. It could be related to ongoing pain, and that needs to be evaluated, but it could be related to addiction. I would say to get other people in your life to help you to structure this, to kind of reduce risk associated with these medications and overuse of them, ultimately could lead to addiction. But if you have other people kind of helping you monitor it, that's beneficial. And it's important to discuss risk factors with the prescriber, because sometimes they're not going to mention this, but If you have a family history of addiction, or you have a history of addiction or misuse of psychoactive substances, it's possible that you are at risk for addiction, higher risk than the general population. And as a result, that discussion is really necessary, and those risk factors have to be taken into account. You can still use opioids, but it would be a much more controlled situation, much more monitored situation. It's important, of course, to have Narcan available, the antidote to an opioid overdose if you are taking these medications. And if you have a family history of addiction, or you have a history of another mental illness, or you have a history of some sort of life trauma, whether it was a war trauma, bad car accident, sexual trauma, that sort of thing, you are at higher risk, and that needs to be discussed with the provider and precautions taken as well. It's important not to mix opioids with other intoxicants, more likely to be problematic and perhaps lead to addiction. And if there is overuse, if family members notice, or someone else brings it to the individual's attention, or the person kind of recognizes, I think I'm getting out of control with this, it's really essential at the early stages to get back to your doctor and discuss that, and perhaps seek evaluation from an addiction expert.
Thank you, Dr. Seppala. Dr. Welsh, one of the biggest issues facing Georgia right now is access to treatment, providers, and services. Can you talk about that?
This really is an issue across the country. The vast majority of people who need treatment don't receive it. There simply aren't enough addiction treatment providers and resources. And for the few individuals who may be able to access care, there are often significant barriers like distance to a treatment center, affordability of that care, and having to overcome stigma that is often associated just with having a substance use disorder. It's because of these reasons that Emory University and the Hazelden Betty Ford Foundation have recently formed a collaboration called the Addiction Alliance of Georgia. The alliance seeks to align with ongoing public and private efforts while partnering with diverse stakeholders to provide comprehensive treatment and recovery support to both insured and underserved people in Atlanta and Georgia. With this collaboration, we plan on expanding clinical services so that they are accessible and available across the state through telemedicine. We'll be focusing on educational initiatives ranging from school-based prevention programs to training prescribers around addiction. We are also developing a research component that will look for answers about best practices and new and innovative ways to approach care, all of which can be applied to Georgia.
Dr. Welsh and Dr. Seppala, thank you so much. We're going to continue our conversation with you a little bit later in the show. Thank you again for being with us.
Thank you.
Thank you.
Opioid use disorder is impacting thousands of families across the state at this very moment. Remember, you can call the Georgia Crisis and Access Hotline number at the bottom of the screen to get connected to state resources for yourself or a loved one. That number is 1-800-715-4225.